This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, well, good evening, everybody. Happy Sunday, end of the weekend. So we see, a lot of head injuries, a lot of sometimes minor intracranial hemorrhages, sometimes more serious related to traumas. We get a lot of transfers of people who, fell, hit their heads and have pretty minor head injuries. And, surprisingly, there haven't been great guidelines on how necessarily to manage these kind of more minor ones. Sometimes you might notice that people get transferred here, they look great, sometimes they even go home, sometimes they get a repeat CT, sometimes they don't. So there's not necessarily clear uniformity, but you probably notice that a lot of these people have these very small head bleeds on CT, they look fine, and you can imagine they mostly do great and don't need a lot of interventions. Very different than the serious intracranial hemorrhages or obtunded, need emergency surgery. So it's a big spectrum. So there is a recent, kind of over the last couple of years, attempt to come up with, I like the acronym, BIG, Brain Injury Guidelines. And what they did is try to kind of differentiate patients into a couple different categories and decide what kind of observation, treatment they might need. And this could be, potentially helpful. They looked at 3 categories, and the most minor category they call Big 1. And these are people who have very small bleeds. They're generally normal neurologic exam. They're not anticoagulated. They're not intoxicated. They have normal exams. And for these patients, what these guidelines recommend is actually just monitoring in the emergency department for a certain amount of time, sometimes 6 hours. They don't need neurosurgery consultation. They don't need repeat head CTs. And if they stay fine, they can go home. And then they came up with a category of Big 2 that is maybe a little bit bigger bleed, not tiny, but not too big, still normal exam, and, not anticoagulated, generally healthy. And with these people, what's interesting is that they can sometimes not be transferred. So for us, that could mean that a lot of these people could get admitted to the whatever hospital they came from, just get monitored for 24 hours. They don't need to see neurosurgery initially. So they could prevent kind of getting transferred from, some small rural place all the way here just to get monitored and just get discharged. And then the more severe ones, still need all the treatment, admission to a trauma center, neurosurgery consultation. So these guidelines are still relatively new and still potentially being, fully validated. But I think it's a good start to potentially avoid unnecessary admissions, unnecessary transfers on these head injury patients that probably, we see a lot of these who come here, get admitted, and probably don't have a lot done. Any questions, comments? All right. Thanks, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.